So all of our sound therapy tools today currently come from hearing aid manufacturers, so that's why they look identical to a hearing aid in most cases. Occasionally we might use something that looks totally different, more like an MP3 player with earbuds, but so many people don't want that corded option because we're so active, and that's why the wireless option is much more popular. So a sound therapy device, the combination instruments that we are using for tinnitus therapy, can be used as amplification with the microphones and amplifier turned on, or as non-hearing aids with the microphones and amplifier turned off. So it just depends on how we set them up, and it's case by case determined. So not everyone with tinnitus can benefit from amplification. So each person, we have to take a unique approach to figure out what's the best way to deliver sound therapy back to their brain. Not all sound therapy is going to look the same, although most people today want a wireless device, and all of our wireless sound therapy can look like a hearing aid. So that's where the confusion lies. We're not just putting amplification on all people because not all people have significant hearing loss associated with their tinnitus. So a lot of people have a hard time with the concept of putting anything over or on top of their ear because they associate that with a hearing aid that maybe their grandfather wore or somebody who they see as much older than them. And so what's hard sometimes is for people to realize, A, nobody's going to notice you have these things on because they're so small, and B, that it can make such a huge difference in your quality of life. Who cares anyway what it looks like? So that's kind of the struggle sometimes we deal with. So if something were sitting just in the ear, people think that that's I don't know, better somehow. But the problem is if you plug an ear, especially for someone with tinnitus, their tinnitus can get louder because now you're keeping all of that sound in and you're not allowing natural airflow around the sound therapy device. So all the units we use today keep the ear partially open so that we don't run the risk of increasing the problem, which is the tinnitus in the first place. Technology has to sit somewhere, so it sits on a tiny little processor on the top of the ear. So this is an example of how small it can be. So when you're wearing, this is exactly what I wear for my tinnitus, and when I'm wearing it, I don't feel it. It weighs less than an ounce. You don't see it. It disappears. And the wire here is what's delivering the sound therapy into my ear. We customize the sound therapy with programming it using the computer after we figure out the tinnitus pitch and loudness match in the diagnostic testing. All that information is then imported into this tiny little chip on the back of my ear, and by leaving that ear canal open, I hear naturally, normally. I don't feel this. I barely even know it's there. And then the sound therapy is just gentle, playing in the background, very low level, calming, soothing. So I can go about my day and I don't even half the time recognize I'm wearing it.
And it looks nothing like those old beige, clunky...
Right, the big old technology that filled the ear, was heavy. We called it the occlusion effect because it would make you feel plugged up, like you were talking through a microphone all the time. You were getting reverberation and echo when you block the ear canal, just like when you put earplugs in. You know, you put those foamy earplugs in and you feel like, am I shouting? I can't regulate my volume. This is nothing like that, but that's what a lot of people think they're gonna have to experience, and they think, well, that's worse than what I'm dealing with my tinnitus, so it discourages them to even come in and see what we have to offer. We can't help someone who doesn't want our help, so we'd rather just get people the right information so they know if maybe I don't want to do this now, but if my situation gets worse, at least I know what I can do for myself in the future. A lot of people, when we put the sound therapy in both ears and they listen to it for a few minutes, they realize right away what a big difference it can make for them. It's calming, it's soothing. We've seen people cry just from putting them in because they get some immediate benefit, some immediate relief and distraction away from their tinnitus. And so, you know, that's why it's so important to test it out and see, can you benefit? Like we always say, 80% of people can, so why not see if you're part of that number that can actually benefit?